Welcome back to Good Day Stateline. Our next stop on the GDS Holiday Gift Guide is a Chicago weight loss clinic with Dr. Thakkar. Thanks so much for having us.
Thank you, thank you.
So there's a lot happening here and a lot of chatter about the detox IV. That's one of the main things we want to talk about today, and how that relates to weight loss. Tell us a little bit about it.
So detox, because we are having overexposure of the toxins nowadays. It comes with the food because there is a pesticides. Our food is not only genetically modified, but it has pesticides, antibiotics, hormone, chemicals, all those things. That brings the toxins in the body. Pollution, environmental pollutions. Also, there is a lot of other things bring the toxins like, makeup. 80% makeup gets sold has parabens, plastic, detergent, water, even the drinking water that we are getting from the county has a lot of chemicals that is harmful. So our system, our kidney and excretory system is overburdened with the toxins and they are not able to get rid of it. But body likes to store these things in the fat and it causes the fat depositions and a weight gain. So we are using naturally occurring substance like glutathione, some of the B complex vitamin, N-acetylcysteine, all those things, and we are replenish those things via intravenously, which has 100% bioavailability to excrete out those toxins. There is a study came out in 2019 in American Journal of Dietetics that detoxifications is sometimes better or much superior, or it's required to lose weight and maintain it. So this is the fantastic approach. When you do with intravenous, the bioavailability is 100%, so you will immediately start feeling effect. While if you are taking any supplements by the mouth, maybe 10-20% goes into the bloodstream because GI absorption and all those things plays the role.
Well, it's good to feel immediately better.
Right, and particularly when the holiday seasons are coming, we are eating so many things outside and all those things. So this gives you a lot of energy and you feel like refreshed and you feel young.
Yeah, and like you mentioned too, it's actually doing something to the inside of your body and detoxing you versus obviously watching to make sure you're eating nutritious foods and getting out and moving and exercising is good for you.
Exactly.
But if you're not detoxing what's inside, then it's kind of like a Band-Aid, huh?
Yeah, exactly, because in last 20-30 years we have so much overexposure of the toxins. If you look at the glutathione level of any individual, which is the main substance that helps to excrete out the toxins, it's depleted. 90% of the population is depleted.
I know that you wanted to talk a little bit about what you have for sale when it comes to detoxes. Usually 6 detoxes are $960, right now $749.
Yes, right now $749. That's our holiday special.
And then B12 lipotropic. Am I saying that right?
Yeah, lipotropic injections. We call it, in a common language, we call it like fat burning injection.
Okay.
It has not only B12, but it has B1, B2, B5, B6, some amino acids known as methionine, inositol, and choline. That also gives you instant energy. It increases your metabolism. So some people use that not only to get the energy, but they help you to lose them weight, because if you follow some low carb diet along with that, if you are working out, that will give you, some fat loss and if you can lose weight. So that we are giving, usually it's like 6 injections for $156. But right now we are giving 12 injections in $159.
That's pretty good. And those probably don't take a lot of time to inject,
yeah, it's just
right?
in and out. And some patients, they come and they can inject themselves. They can just come and get the injections and take home, and they can inject themselves twice a week.
What about the new weight loss drug you want to talk about?
So there are a couple of new weight loss drugs came out in last 3 years. The 2 came out that was initially used for the treatment of diabetes. The first came out, that is come out from the company known as pharmaceutical known as Novo Nordisk. The first one came out Saxenda. So we call it GLP-2 receptor agonist. The way it works, not only it helps you to decrease your appetite, but also it increases your satiety. So let's say your favorite food in front of you, just for example, cheesecake.
Sure.
And you will take 1 or 2 bites and you will feel full. So that's, then you cannot eat more than that.
Sure.
It also affects your glucose transportation, so that also helps you to lose weight. So Saxenda came out 3 years ago. It was daily injections. Last year in June, the new drug came out, which is known as Wegovy. The generic name is semaglutide. That you have to take once a week injection. It's easy weight loss. So we like to start with that for some patients. Once they lose around 20-25 pounds over the period of couple of months, then we work on healthy habit creation, some new mindset, improving self-beliefs and all those things. So that is very, very good medicine. And with the combinations with our program, we have so many patients have lost a lot of weight and they are able to maintain it.
That's why sending, your friends, your family, yourself to Chicago Weight Loss Clinic this time of year in January too. Probably a great time to stop over, huh?
Right, because New Year resolutions,
yeah.
Exactly.
I know that you are giving us our giveaway for the GDS Holiday Gift Guide, a lipotropic B12 complex with a fat burner, and a gift certificate, so you can check that out at gooddaystateline.com. That's right. Check that out at gooddaystateline.com and enter to win. Coming up next, it's Air Friday with No Joke MMA. We'll be right back.